Alright, hey guys, it's Murphy again, and yep, I'm back on SurgerySquad.com, and this time I'll be doing breast cancer. Yep, so for all them ladies and men too, this will be a little educational and informational for you guys. So let's get into it. Loading. SurgerySquad.com.
Welcome to Surgery Squad's Breast Cancer Awareness course.
Hi.
I'm Dr. Susie, and I'll be providing you with
Hey,
vital and
Susie.
potentially life-saving information about breast cancer. For those with a weak stomach or have children in the room, I need to let you know that this information is a bit graphic and contains nudity. It may not be appropriate for work or school environments. Click the continue button when ready.
So guys, if anything is going on where you are watching this matches any of those criteria, wait till you're in an environment where you can watch it. Okay? When you're getting in trouble or getting anyone sick, their stomach upset or whatever, not fired from work or anything. So yeah, just stop watching the video now, watch it another time. But for anyone who else can watch, let's go.
To better understand breast cancer, we'll first review the basics of cancer itself. The word cancer refers to a group of diseases that are the product of mutations in genes, specifically the genes that are responsible for regulating the growth of cells in the body.
Interesting.
When the growth of cells becomes uncontrolled, a cancerous mass, or tumor, develops within the body, intruding and destroying adjacent tissues. While it is nearly impossible to confirm what caused a specific cancer in a person, scientists and researchers have been able to categorize the potential causes of cancer into two groups: environmental factors and hereditary genetic defects.
Really?
Environmental factors make up approximately 90 to 95% of all cancer cases.
Are you serious?
These are things such as alcohol and tobacco use, obesity, poor dieting and exercise habits, and pollutants.
Okay,
Hereditary genetic defects make up a small percentage of cancers, between 5 and 10%, and include BRCA gene mutations, which greatly increases the lifetime risk for breast cancer in women and men.
You hear that? Women and men. So men, yep, you can get breast cancer too. So, but it's just more likely to happen to women, because as you see at the bottom there, bottom left, it says 1 in 8 women will get it, and 1 in 1,000 men. So men is less likely, but there's still a chance. So watch yourselves. Let's go.
Breast cancer typically begins in the milk-producing glands of the breasts, and if left untreated, the cancer can make its way into underarm lymph nodes. These lymph nodes provide the cancer with a pathway to other parts of the body. This is referred to as metastasis. While breast cancer may be a frightening topic to think about for most, it can be overcome. If you or someone you know has been diagnosed with breast cancer, keep in mind that there are more than 2.5 million breast cancer survivors in the United States, and scientists are working around the clock to develop new treatments and to find a cure. Before we move on, take a few minutes to review the various stages of breast cancer using the arrows below.
Okay. So stage 0, the earliest form of breast cancer. At this stage, cancerous cells are still located within a duct and have not invaded the surrounding tissue. Okay, this is just the beginning. Let's see what's next. Stage 1A, IA, I guess it should be 1A, whatever. The tumor is smaller than 2 centimeters across. The cancer has not yet spread to the underarm lymph nodes or the distant areas during this stage. Okay, look at that tiny tumor, but it hasn't spread as yet. Alright, so it's not that bad, but it's there. Stage 1B. The tumor is smaller than 2 centimeters and has spread to 1 to 3 underarm lymph nodes. Wow, it's getting out there. The cancer has not spread to distant areas during this stage, but it's moving. Stage 2A. The tumor is still smaller than 2 centimeters across and has spread to underarm lymph nodes, or the tumor is larger than 2 centimeters across and smaller than 5 centimeters but hasn't spread to the lymph nodes. Interesting. Okay. The cancer is not spread to distant areas during this stage. So it's not good, but it's not that bad because it hasn't spread to distant areas. Okay, let's keep going. Stage 2B. The tumor is larger than 2 centimeters across and smaller than 5 centimeters and has spread to the underarm lymph nodes. Oh my gosh. Or the tumor is larger than 5 centimeters across but does not grow into the chest wall or skin and has not spread to lymph nodes. Okay, I guess I don't know if that might be the better one, although it's larger. Well, it's not good at all, but anyway. The cancer is not spread to distant areas during this stage. Okay, so still kinda in a safe thing. Guess these are the stages where if you catch it early, you know? Stage 3A. The tumor is smaller than 5 centimeters and has spread to 4 to 9 underarm lymph nodes. Wow, it's getting out there. Or the tumor is larger than 5 centimeters across but does not grow into the chest wall or skin and has spread to 1 to 9 underarm lymph nodes. Oh my gosh. The cancer is not spread to distant areas during the stage. Okay, so we still can get it out there. We can fight it. Fight it. Stage 3B. The tumor may be any size and has grown into the chest wall or skin. Oh my gosh. It may also have spread to 1 to 9 underarm lymph nodes. That's not good. But it still hasn't spread to distant areas during this stage. Okay, let's move on. Stage 3C. Invasive breast cancer, which has spread to 10 or more underarm lymph nodes above and below the collarbone, and lymph nodes near the breastbone. Wow. But the cancer still hasn't spread to distant areas during this stage. Stage 4. The tumor may be any size and may or may not have spread to nearby lymph nodes. During this stage, the cancer has spread to distant organs or to lymph nodes far from the breast. Oh my gosh, this is where it gets horrible, guys. The most common sites for the cancer to spread are the bone, liver, brain, oh my gosh, and the lungs. Wow, this is serious.
There are a variety of breast cancer treatment options available. The treatment for each patient varies depending on their breast cancer stage, overall health, and willingness to try the treatment. Click on each treatment option to learn more.
Okay guys, let's learn more. Let's go in order. We're gonna do surgery, then radiation therapy, systemic therapy, then holistic therapy. Alright, let's go. Educational. Guys, remember, like, comment, subscribe, share. Thanks for the support.
If surgery is the preferred method of treatment, a surgeon will typically go with one of 3 procedures to physically remove a tumor. These include a lumpectomy, where a small portion of the breast is removed in addition to the tumor.
Wow.
A quadranectomy, in which a quarter of the breast tissue is also removed. And a mastectomy, in which most, if not all, of the breast is removed.
That's sad.
Some of the underarm lymph nodes may also be removed if it is discovered that the cancer has spread. After a mastectomy, many patients elect to have a breast reconstruction surgery immediately afterward. During this procedure, the surgeon works to preserve the appearance of the breast using prosthetic material or tissue from other areas of the body.
So they want like a booby or a breast right after it's gotten cut off. But they take from other parts, I guess. I don't know. They probably take from your butt. I'm not sure. But yeah, guys, this is still a serious thing. So take care of yourselves. Okay, radiation therapy.
Radiation therapy is generally used to enhance the effectiveness of a lumpectomy, but is also used in combination with some mastectomies. It involves using a high-powered X-ray to destroy cancer cells that remain within the body after surgery.
Okay, that was short and sweet. But yeah, radiation therapy can also be used. Now it's time for systemic therapy. It's an injection needle? Oh man.
Systemic therapy is the use of medications to treat cancer cells and can be used in combination with each other to boost the overall effectiveness of the treatment. Chemotherapy, hormonal therapy, and immunotherapy are all types of systemic treatments.
Okay, cool. And now for the last one, holistic therapy.
Holistic therapy is less of a treatment option and is primarily used as a method of reducing stress, improving mood, and enhancing a patient's quality of life while they go through conventional therapy. Examples of holistic therapy include acupuncture, aromatherapy, yoga, and guided imagery. It is recommended that patients discuss holistic therapy with their physician before attempting it.
So basically what holistic therapy is saying to me is that it gets the persons comfortable, relaxed, no stress, although they have a disease, but yeah, it gets them relaxed in order to choose one of the other forms of treatment. That's basically what I'm getting from that. But yeah, well, let's continue, guys.
When it comes to protecting yourself against breast cancer, your first line of defense is a monthly breast self-exam. Statistically speaking, a breast self-exam doesn't have the potential to reduce the incidence or mortality rates of breast cancer, but it does allow women to become more aware of how their breasts naturally feel. This makes it more likely to notice an irregularity. While monthly self-breast exams can be effective in the discovery of surface abnormalities, your best defense against breast cancer is to get regular screenings. It's recommended you discuss the different types of screenings with your physician to help determine which is right for you. Click on each one to learn more.
Alright, well, we learning. I don't know if we're gonna actually get to do any surgery in this one or it's just teaching us. But hey, it's very informational. It's very educational. So let's continue. Mammogram.
A mammogram is a low-energy X-ray of the breast, and it's currently the most effective screening option for detecting the early stages of breast cancer. Most doctors recommend that all women 40 and older have a mammogram every year. Those younger than 40 should discuss their personal and family health history to determine how often they should get mammograms.
So guys, go get checked. Find out when you need to get checked and get checked. It's better safe than sorry, right? Clinical breast exam.
Most women have clinical breast exams done by their OB/GYN when they have their Pap test. It is recommended that women in their 20s and 30s have clinical breast exams performed every 3 years. Those 40 and older should have them done every year.
You guys saw the info. Get it done. If it's a guy watching this video, pass it on to your girlfriend, wife, daughters, mothers, any woman out there you may know. Because this is not something to play with. So, as I said earlier, better safe than sorry.
And that's all I have for today. Thanks for taking the time to learn more about breast cancer. See what else you can discover here on SurgerySquad.com.
Aw, I didn't get to do surgery on that one. That's not fair. But hey, thanks for watching, guys. Like, comment, subscribe. And yeah, I'm gonna do another one. I think I'm gonna do maybe that silicone breast implant surgery next. We were just talking about breast cancer, so I think that would be the best thing to do next. So yeah, guys, thanks for watching. Hashtag like a boss. Smurf, peace.